All right. 210. Hey guys, this is Natasha with Norteño 210 Podcast. Thank you to VodPod Media for housing and producing, and to Latina Podcast Network for having me on your network. Guys, if you're listening, go watch. And if you're watching, go listen. Make sure I'm on Spotify, Apple, and YouTube. And yeah, you're going to want to see who I have. And I say it every week, but I promise you're going to want to see who I have. I have special guests, and it's multiple guests, which I've never had. So this is the first time. And yes, so please introduce yourself.
Hi, I'm Sylvia Muniz. I am the one of the RNs, administrator and director of nursing of Harmony Hospice Care.
Okay.
And I am Mrs. Lis Hospice, Director of Business Development and Patient Relations with Harmony Hospice Care as well.
Okay, so tell me about Harmony Hospice Care.
So Harmony Hospice Care, thank you. First of all, I just want to say thank you so much for having us on the show today.
Course.
And thank you to all your audience for having us here. And I know people automatically, they hear hospice and they think they're going to hear something terrible, but it isn't going to be terrible. What we're here today is to explain, and what we want to do is we want to get the awareness of hospice out there. That's basically why we're here today. So basically, in a nutshell, I think everybody has kind of had an idea of what hospice is, but we want to kind of flip the narrative with that and say that hospice is not about death and dying. Hospice is about living with a terminal illness. And so, with people who are living with a terminal illness, there's a different kind of living that happens at that point, and we're the added support, and we offer a higher level of care that comes in and provides the care that they need at whatever point they are. It's individualized, tailored care for them. So if they are in need of course, we have a nurse that goes by, our medical director, our CNAs. Of course, as we're going to talk later in the show, we also have our music coordinator, who is Shellylus, who goes and speaks and sings and offers a different type of comfort. And so we also have our chaplain, our social worker. They all do different things, and we all have different, I don't want to say agendas, but we all have different tailored type of care that we offer to the patients. And so it's important to us that the patients feel that they feel not only loved, but they feel heard, that they feel supported, that they don't feel like they're going through this by themselves. We're a team of people that come in at a time where someone is not probably adjusting well in their lives, or maybe they are, or maybe they have a caregiver that's overwhelmed and they need that added support.
Sure.
Or maybe they're tired of going to the hospital. You get to the point, where family members are just going to the hospital. It's like, they don't want to do that no more. And it's like, I just want to stay home. I want to stay comfortable. And that's where comfort measures come in. And so this is what Harmony Hospice Care does. We provide comfort measures at end of life. And so for anybody that has a terminal illness. And of course, end of life doesn't mean 1 day, 2 days. It doesn't mean tomorrow. It doesn't mean that you're going to die, as soon as you come on our services. And it definitely does not mean giving up hope. And so, we, of course, we have to, certify that you are 6 months or less to live if you had stopped everything. But it doesn't mean it's going to happen at that time. We honestly, it's like I always tell my families and my patients, you don't know. I'm not God. It's still between you and God. God is still in control. And so, for us, and I'll let Lyris talk a little bit more about this too as well, because I don't want to hog up the mic, because I can do that. but for me, this is a very this is a big calling on my life to do this. I've been doing hospice nursing for over 10 years now. I started as an LVN and have worked my way up through the hospice, and so now I've helped start agencies. I've trained a lot of nurses, trained a lot of people in hospice, with regulations, documentation, things to that effect. And so, I love hospice. I love the program. I love what it's about. And so it's just a God-given calling for me. And I think for all of us, we've all in some way feel like this is where we need to be because it is our calling of where we need to be. I don't know if you want to add on to that too as well.
Yeah. Sorry,
go ahead.
just
No, 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 go
quickly,
ahead.
are you guys, is it adult only or is it lifespan?
It is adult only.
Okay.
It is adult only.
Okay.
Yes.
Yeah, there's a difference between the pediatric hospice.
Yes.
Sure.
For the children, of course, under 18 years of age that are struggling with terminal illnesses. But our primary demographic is senior care, elder care,
Yes.
and the majority of our patients are 65 plus. I mean, we do get a few every now and then that are in their 40s and 50s that are going through a terminal diagnosis or a debility that's causing a decline in their life. And so, we our youngest, I think, to date, as far as
I think she was like
our
42.
patient, yeah, she was 42. But it would be the adult demographic that we service.
Yes.
Okay.
And seniors mostly. Yeah.
Yes.
Yes.
So what's your exact role or the role that you play with Harmony Hospice?
So I play kind of a two hats. I wear two hats, and that is first and foremost, it's going to be patient relations, and so that's connecting with the community and educating and building connections and relationships with the senior community, because there's a lack of education of what hospice benefits are and how they can utilize them.
Definitely.
Because a lot of seniors don't have access to smart devices or know how to use the smart devices like we do. The ones that are going to know how to do that are like the children, which are the ones in their 50s and 40s or 30s even, right? We're all savvy on the phone or on the computer, or just to even pick up the phone and call 311 or 211 to get information, right? But seniors don't know how to gain access to stuff that's on the internet, important information that's on the internet.
Right.
And so it's getting into the community and immersing them with education about end-of-life care. Now, number one, end-of-life care, no one wants to talk about that. Just even saying that, it's like, that's death, I'm dying. No one wants to talk about death and dying because it's taboo. We don't want to talk about the loss of a loved one. You might hear family members, or I'm sure friends or family might say, don't say those things, or I don't want to talk about my funeral right now. It's like if we talk about it, then it's causing it to happen much sooner in a kind of way.
I think part of that is a cultural thing too.
It is. It is very much a cultural
among
thing.
the Latino population is no, mija, don't do that. You don't say that. You're gonna you're gonna put that out there.
Yeah.
Versus, it's very important for all of us to have those conversations. When my grandma passed away, she had an entire plan. What she wanted to wear. Yeah. Oh, yeah.
That's rare.
Oh, that is very
yeah.
rare.
That is very
yes.
rare.
Yeah. Did it all
She was
happen that
ready.
way? No.
Yeah.
Because, there was, I think, 7, 8 siblings or kids. So,
And everyone has an opinion.
So that was
Right.
that was fun.
Yeah.
But yeah, I mean, seeing firsthand and experiencing hospice care, not just with my grandma, but myself personally, because I've been in healthcare for 10 years, almost 11 years. And so I did work hospice. And I think there's something beautiful about it, honestly.
I think you're right, yes.
About the end of life and really getting to talk to people. And my whole thing is, when I would talk to people, or even patients that I had in the hospital that were, passing or were very sick, I would kind of try to liven up the mood and be like, okay, so what's the secret to life? Or, what's the secret to a long marriage? And get them kind of reminiscing a little bit.
Of
and
course, we
about
call
the
them
good
life
times.
reviews, yes.
Right. Or, hey, tell me some of the really cool things that you accomplished in life. Also biggest regrets.
Yeah.
Right.
Yes.
And so, it was always almost always, the things I didn't do. It was the what ifs. And so because of that, I live my life personally as like, no, I don't want to have any what ifs.
Right.
And technically any day could be our last.
Yes, you're right.
And so, I mean, I YOLO, but to an extent, right?
Yes,
Like,
yeah, to a safe sense.
right, because I also have
Yes,
kids.
Yes,
but it's true. It's very important for us to start having these conversations if we aren't already.
Right.
Yeah, there's one of the terms that we use is having a good death. No one thinks about that. Like really looks at the details of what that would look like. Like, when there's a tragic death, that means that individual has all of a sudden passed,
Right,
because of an accident,
Right.
And one of the things, coming from a spiritual perspective, one of the things that we believe and we feel is that when a person is going through a decline in their life because of an illness or series of illnesses, we can have the opportunity to help them have a good death and have the family be able to grieve appropriately or healthier, right? Because if it's a tragic situation, well, none of us can help those sort of situations.
Right.
But if we can at least maybe come together, provide support, provide the opportunity for the families to let go of conflict, reunite, bring that togetherness, back to the family.
Right.
I mean, that just makes that person's death a little bit more easier. And no death is easy, right?
Sure.
But at least there's some closure, and families have the reassurance that they can be okay, that they're going to be okay grieving, and that it's okay to grieve. Because
Absolutely.
part of not talking about death and dying is also no one wants to talk about grieving.
Right.
That it's okay to grieve. That it's okay to
Miss somebody.
to not be okay.
It's okay to not be okay.
Yeah, and so having a good death is important, and to be able to talk about what those patients' wishes are,
Right.
what the family's desires are, also too. And so, but in my role as a patient relations person, that I connect with those families and really just meet them where they're at to find out what it is that angers them, what causes them frustration, what burdens they're carrying, what is making them really depressed,
The challenges.
really sad.
The challenges.
Right.
And the reason why we focus on finding those things out is because it helps us build a plan of care that is specifically tailored to that individual and their family that's involved, if there's family involved with them, right?
I love that.
Yeah, and that's so important because hospice is a higher level of care where an individual can not only receive comfort care clinically via nurse and medical director, hospice doctor, but also they can receive services holistically.
Right,
And
it's a
that's
holistic
emotional
approach.
support. That's spiritual support. Someone that they can talk to, counsel with.
Right, which is just as important.
Very
Right,
much
exactly.
so. Very
Now,
much
I
so.
know that you mentioned about getting out there in the community. What about the patients or potential patients that are stuck at home? They can't get out. They can't do anything. How have you guys been able to mitigate that?
Go
That's
ahead.
a very difficult,
That's hard.
that's the hardest part there, which is why we're coming out and doing the awareness, is because, we're talking about, abuelito and abuelita, we're talking about them. They, I go into these homes and they probably are on the Spanish channel all day, or they're on, Grit TV or something, watching the Westerns or something to that effect. And so they may not be doing these shows, but in looking back into our research that we've been finding on Facebook and TikTok and all those kinds of things, our biggest following are females between the ages of 18 and 45. So we know that they're the ones that are looking, and they may be looking for their grandparents, or they may be looking for their parents, or maybe it's something that they're thinking about getting into, or maybe a lot of things. But that is our biggest following. And so, which is why we're coming out here now and trying to make the awareness, because we see where our audience is. And so we want to meet our audience, because those are the people we need to reach in order to get behind to their grandparents or parents.
Now
Right.
there's other opportunities
Of course.
where I will collaborate with an activity director either at a retirement home or a senior apartment living complex where the primary residences are the seniors. I'll work with them and they'll allow me to come in and provide some refreshments and have us sit and sit down with them and allow them to ask questions and get informed. We want people to be able to make informed decisions.
Of course.
You know, we don't want them to feel like this is something that they have to do, but that they worked for this benefit because it's covered under their Medicare, because that's one of the other, I was going to touch on that a little bit, but because we serve the senior demographic, 65 plus, more than likely they're going to have Medicare already in place. And just because they have their Medicare in place, doesn't matter what supplements and A, B, C, D, F, G they have, we will be able to utilize their hospice benefit under the Medicare plan to have the services covered at 100%.
Oh, wow.
And that's new and alarming to them because they're like, I didn't know. I thought I had to pay. Do I have to pay a copay? You know, I mean, they are already getting scammed.
Of course.
In other ways, you know, and so they're always getting bills and things like that. And so we try to reassure them like, look, you're not paying for this service. You paid into it when you worked, but now and if and when you're ready to use this, you can use this benefit. And it's not permanent because when you decide that you want to see what this is like and try it out, let's see if we can work together to get you to a place where your quality of life is improved. You're receiving clinical services. Someone's monitoring you week to week. You're receiving counseling from a chaplain, counseling from the music coordinator, music ministry. Someone's coming in to help you bathe safely so you're not falling, having more falls.
Right.
Let's see how we can work things out. And after a couple of weeks or a couple of months, they're just really comforted by the fact that people are actually listening and caring for them.
Of course.
And later down the line, sometimes when it comes up to the 6 months or the 8 months or whatever it is, we have to let them know and say, look, you're doing pretty well. Let's discharge you from services and reconsider you for a different for at a later time, you know, and usually they're just like, no, my services.
Of course. I mean, I would be too.
Yeah, I know.
But we reassure them, you know, look, if it comes to a point where you are no longer, you know, or you will be needing us again, absolutely call us back so that we can follow up with you and reevaluate and take it from there. You know,
but to add, you know, to add more to that too as well is. So Lis, who does all of our business growth development, she goes to doctor's offices. She'll go to skilled nursing facilities, assisted livings. There's so many out there, and so we just, you know, go and we do a presentation about our company, and we give them the opportunity to send referrals or talk to their patients about our company if they're needing our services, or we. You know, if they give us the name, we'll go speak to them in their home. It doesn't necessarily have to be in that office, but we can go to their home. Or a lot of times, it's actually word of mouth, where, you know, family members or friends and so forth. And I think to me, that's the biggest honor in having to do with hospice. Is that if you've serviced somebody and they know how you worked and they loved how you cared for somebody and them, and they can refer you to somebody else that they know, that to me is the biggest honor, because now it's like I'm getting to know their community. And so, and we don't take that lightly. That's very important to us, to connect with that community the way that they allow us to do.
Yeah, definitely. Yeah, and I think too, because I just keep thinking about like other ways to reach out, right?
Of course.
I mean, even going to some of the nursing schools here in the city, and you know, or the community colleges.
We just did that. We just did that for am I going to say it right? Latinx? Yes, Latinx. We were at Palo Alto.
Yes.
Oh, is it Palo Alto?
Yes.
Yes. Okay.
Yeah.
Okay. I'm just kidding.
Yeah,
Yes,
but I mean, like, you know, all St. Philip, SAG, friggin', what's it called? Galen, you know what I mean? Because they're the ones that are starting. So you plant that seed, and whether they want to come work with you, for you, or they end up in ICU, or they end up in, you know, home health care, immediately they're going to be like, wait, I remember this one place, and then it's immediate referrals. You know what I mean? Because they just remember.
Yes.
Right.
Or health
Yes.
fairs, but also how do you make hospice fun, right? Because social media is so important. And without that presence, I mean, as far as internet wise, and no pun intended, but you guys are dead.
Yeah.
You know what I mean?
Yes.
And so it's very important to get yourself out there and get your names out there. And of course, it helps to have a music coordinator.
Yes. It does help to know to have Shellylus.
Yes.
Not just any, not just any music coordinator. It's Shellylus.
Yeah. So,
Yes.
I mean, I think even just that, all of you guys talking about it, but changing that taboo, putting that taboo on its head, and
Right.
no, we have to talk about this, especially people that look like us, and it's important to have this conversation. I tell my friends, oh no, like cremate me. I told my lash girl, make sure my lashes are good. I told my nail girl, make sure my nails are good. I'm gonna have a DJ. I already locked that in. I have 2 DJs. You know what I mean? So like,
Yes.
it's gonna be
a party.
It's gonna be a party.
Yes.
I mean, whether
Yes.
whether it happens soon or
Yeah.
50 years from now,
Right.
I want to make sure that my plan is set.
Right.
And so, and I tell the people closest to me, not just, a spouse or, a parent, whatever. No, if we're besties, guess what? I'm telling you, this is what I want. And there's no questions about it.
I love that. I love that because that's the first thing that needs to happen are the conversations, because these conversations are difficult. They're hard. But the thing is that people are not used to getting to that deep. And it doesn't need to have that deep of a conversation, where we're really talking about the nitty gritty of death. It's just talking about the wishes and following through with your wishes. I have a TikTok as well, and I talked about that final wishes and why people don't follow through with final wishes. And so, and I also talked about characteristics of a hospice nurse as well, what people look to see as a hospice nurse. And so, I think that, for one, getting back to the first part of your question, is getting out there on social media, is getting to know us. It's getting to know all of us and getting to know basically what is important to us. And so when we talk about hospice, they see how much it flows and how easy it is and how passionate we are. And they may not see all the excitement and the joy and everything, but they can see the passion and they can see the true sincerity that we want to help. And so that's really what we try to get out there. And the only way that we're going to flip the narrative, so to speak, about, hospice is not about specifically the nail in the casket. It's not about that. That's not what it's about. What it's about is during that time frame when we come in to when you take your last breath, all of that in between there, that's life to us. You're living in between that time. Yeah. And in between that time, that's the important time that we want to get in between there. And so we're going to hit it. We're going to come in and we're going to ask, like what you were saying, like what you did with your people with your clients when you worked in hospice. What did you do for a living? What kind of music do you like? And then, we're going to start pulling all that information out of you, and we're going to start, using it to cater to whatever it is that you are needing at that time.
Yeah.
So, I mean, it's, so social media is a big thing. I'm going to tell you, it is hard. It is hard because whatever I post on TikTok, it may not do well on Facebook, but then if I post something on Facebook, it does really well and it doesn't do good on TikTok. And so, and Instagram's a whole nother beast. And so, it just depends on what it is. But we throw everything out there, but we are very active on social media. So if your audience wants to find us, we're on Harmony Hospice of San Antonio on Facebook. And on TikTok, I am at Hospice Nurse Sil, SYL, Nurse Sil.
Okay, awesome. So we're going to segue a little bit because we do have the musical director extraordinaire here in the building. Was there anything else that you wanted to add?
Yeah, I'll just add some really important numbers here regarding the use of hospice. In 2019, every year there's statistics that are run, demographic for race, and we look at our Hispanic community and what does that percentage look like for the use of hospice within our Hispanic culture. Now, this is nationwide. This particular statistic is nationwide, and it's 9% of Medicare hospice
9%.
Patients are Hispanic, and that was from 2019. And so what that looks like is on paper and in the numbers, it looks like our Hispanic community there's factors that are contributing as to why there's not a huge use of hospice within our community. Now, we do have some, like, you know, you're Latina, you're very educated, and you already are headstrong. You know what it is that you want, and you're decisive, and you can just immediately make decisions, you know. But when we look at our elderly population, they're still in that culture, traditional culture of, oh, no quiero decir nada. I don't want to say anything. I don't want to talk about those. No, mijita, no te preocupes. Don't worry about this or that or whatever, right? And so it's really just, like I say, connecting and making sure that our seniors know that they're heard and that they still matter and that people care about them, even if it's a stranger.
Yeah.
You know, even if it's a stranger, we want them to be empowered with the okay and the information that it's okay to choose these services so that they can understand what it can look like for them to have a good death.
Yeah.
And which would be a beautiful thing.
Absolutely.
You know?
Yeah. I mean, the one thing that's inevitable is death.
You're absolutely
And
right.
So,
Yes.
yeah.
We're all going to go through it.
We are, you know.
That's just the plain out truth.
Right. And it's life.
Yes.
Yeah.
Death.
Yes.
So, yeah, thank you so much for
course.
being here. And
Thank
for those
you.
statistics, that's very interesting. A little disheartening. So
Yes.
I'm definitely willing
We're trying to
help
change that.
Yeah.
We want to
Yeah.
see numbers
we
go
really
up.
want to see those numbers
every
go
year.
up.
Yeah.
At least in our area, the area that we are servicing, you know, actually, if however far your audience goes, let's try to bring awareness to hospice and share what little or however much we know. Let's just share it.
Definitely. Yes. Thank you so much. I
Of course.
appreciate
Thank
it.
you so much.
Yes.
This is wonderful.
Thank you.
Thank you.
So I'm going to go ahead and bring Shellylus to the stage. Bam, 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 bam. And she walks away.
I know, right? She walks away. Appreciate it.
Welcome back.
Thank you.
Yes.
Last time we were talking about my retirement.
I know. How's that going?
It's going.
Yeah.
Yeah.
Well, I like to say, I mean,
Yeah, right.
I mean, retiring from stage, but
Yes.
obviously, you know, there's a big evolution that's happened for me in the past 2 years. It's just been crazy. But, you know, I had shared with you the reason that I was retiring from the road every single weekend, y'all. And everyone's asked why. I'm like, well, 40 years is why. I mean, I
Right.
did the same thing for 40 years consistently since I was 10 years old.
Yeah.
I was ready for something different.
Yeah. A little bit.
So, you know, hospice was what I wanted to do. That was my big thing was I wanted to be a hospice nurse. I just wanted to work in hospice. I felt like God was calling me to do something more.
Yeah.
And it was crazy because the first year that I was going to be off the road, I was already planning on starting nursing school April of 23. Well, my cousin Sylvia here contacts me like February of 23 and offered me this position to do music support, music ministry for Harmony. And I just, honestly, I didn't know what to think. I was a little bit confused at first. I was like, okay, I honestly dropped to my knees and prayed to God and said, am I deterring from where I thought you wanted me to be? But he made it abundantly clear to me that he was giving me my hospice, like that's what I wanted, but wanted me to do it through music. And there were other blessings behind that I was putting on hold because I was thinking, this is what I'm going to do. This is what I'm going to do. I'm not going to have time for anything else.
Yeah.
Because we know, I know it's such a commitment for y'all going through nursing school. It's a full commitment. And so I didn't see myself doing that and a lot of other things, but I accepted, and which had been great for me personally, because even when I was contemplating nursing in 2015, I went and walked into a home health place because I thought I wanted to do caregiving because I wanted to make sure
Yeah.
that that's what I wanted to do.
That's smart.
So I knew I would love it. I knew it. And I immediately got paired with hospice patients. And they loved me so much that they wouldn't even want the nurses to deal with them. They were like, no, we want Shelly. And I'm like, but this is your nurse, you know, your nurse knows more than me. So I fell in love with it even more, you know, but I was just too busy to start then. So it wasn't anything new to me. I was already kind of singing to these patients. I was playing music for them. And, you know, music is such a powerful gift. I mean, it's such an amazing gift to have.
Definitely.
Because it's the one thing that we all have. Music is healing, not only for the heart and soul, but it can be like it for your body. You feel this sense of calmness, you know, or release or joy, you know.
Yeah.
And you know, Harmony Hospice Care is about comfort, right? So being that we tailor everything for the patients, Lis fills me in. When she gets to know the family, that's when she tells me, this patient loves this type of music. This patient was this patient used to be a musician or whatever. And I basically will do whatever the patient loves. I don't go in there with my own set list. You know, it's like what they want.
Yeah.
So I love to share the very first time that I visited with the patient with Sylvia. The daughter knew who I was. So she was like, wow, Shellylus is here to sing for my mom. And, but she did say to Sylvia, I don't think my mom is up for it today because she was having a bad day. And Sylvia just said, allow Shelly to go in. Let's see what happens. Because I go by their vibe too. If I feel like it's just not happening, I don't force it upon them.
Sure.
So we walked into a separate room and she was there laying down, beautiful small lady in the fetal position with her eyes closed. And they had informed us that she loved singing mariachi music.
Oh, wow.
And so I leaned in and I introduced myself and I said, she didn't open her eyes when I said my name or anything. The minute I said mariachi music, I said, I hear you love mariachi music. And when she heard that, her eyes opened, right? Aww. And she says to me quietly, I love boleros. And I said, me too. I said, can I sing my favorite bolero for you, which was Mil Besos? And she nodded and I started to sing, Encontrado en tu amor. And she opened her eyes really wide and she started singing La Fe Perdida and just started singing with me. Oh. And she grabbed my hand and we were having this moment together of just night and day. And she was crying. She was crying. The daughter was crying. I was almost crying. Yeah. And it just warmed my heart so much to see that, even because music definitely helps with fear, anxiety, depression. It's emotional support. It helps with pain management because it kind of helps deter where the pain is. It helps for people who are nonverbal.
Yep.
You know, people who are bedbound.
Yeah.
I go in there and we have, you know, sometimes patients want to be filmed. You know, they want to remember this moment, or we'll ask for permission. Yeah. But they normally they grab my hand, they're dancing with me, their feet are going crazy, you know, and they're like, or they throw gritos sometimes. And, you know, dementia patients, it's very incredible. I mean, it's incredible with the dementia patients.
Brings them back.
Yeah, because
to who they used to be.
Yes.
Because there was one in particular who was a previous musician also. And I walked in. Some days it was hit or miss. Some days I'd walk in and he'd be looking at me, but he always asked me who I was. Every time, you know, he would not remember me. And this one time in particular, I walked in, he was in his recliner with his eyes closed. And I always go in there with a lot of energy. And I said, I know you're tired of looking at your eyelids. I want you to look at me. And he just starts smiling, opens his eyes. And I looked under because he used to play saxophone. And I looked under the table and I saw it there in the case. I saw the case. And I said, what's that right there? And he's like, I don't know. I said, let me see what it is. So I opened it and his eyes got big. He's like, I guess that's my saxophone. And I'm like, yeah, I want to hear you play it. And he's like, oh, I can't play that. And so I put it together and I handed it to him. I said, try it. Let's see what happens. So he started playing and he was surprised himself that he was playing. And he just started going off. His daughter ran into the room, was so surprised because he hadn't picked it up in years.
Yeah.
And, you know, again, he asks me, who are you? What's your name? But I would start to sing his favorite song and he would sing every word with me. So it's just beautiful to be in this position because I have entertained thousands upon thousands of people in 40 years. And I've made amazing connections with people and
Right.
fans. But there is nothing like bringing joy and comfort to a person who is about to transition.
Absolutely.
There is nothing like
Yeah.
that.
And it's, I wish there was more people that knew that feeling.
Right.
Because
Yes.
seeing death and not in, of course it's sad, right?
Right.
Of course.
But being there with people as they're transitioning, not just family. I mean,
It's a spiritual
it's
experience.
it's
Yes.
made personally. It's made me love life
Right.
Yes.
more so.
Right.
Yes.
I'm thankful for every
Exactly.
Yes, it makes you,
You
so
know,
grateful.
And we're all going to
yes.
be in this position
Yes.
Oh,
someday.
yeah.
We're
Yeah.
all going to be in this
Yeah.
position. And I mean, that's what I love about being with Harmony is because we really care about our patients, like to no end.
Right.
I mean, it's hard not to.
Right.
You know, you spend so much time with these patients and you they talk to you and you
Yeah.
get to know them. And, you know, sometimes I'll go and I'm there for like over an hour, you know, just I'll do songs and then we just start talking, you know, but there's nothing like that. And we're all going to be in this position. And I know, and it's exactly, I feel exactly the way Harmony does. You know, death is not the end, it's the beginning.
Right.
So my heart with, you know, allowing for myself to be there and contribute in any way that I can, in a positive way, in a comforting way for them before they go on to the next life. You know, it's just nothing compares to it. And
Right.
I'm so grateful. And we are one of the very few companies that offer this.
and I love that.
So, I mean,
Yeah.
that's another thing that sets us apart from other companies is that, you know, we do offer this.
And I think too, people don't understand the significance of what time and energy really is. So
Right.
for you, it's, oh yeah, I'm going to go see this patient, which it does mean a lot to you. But for you, you know, yeah, I'm going to go see him for an hour. That hour could be the highlight of their week,
Yeah.
you know, and if they pass that week,
Or it could be the final hour I've spent with them.
Right.
You know,
Right.
and that does happen.
Yeah.
It did
It
happen
does
recently. You know, there was a patient where she wanted a party. She wanted a party. She wanted to hear her favorite music. She loved Cruz de Madera. She loved that song. So, you know, I walk in, she was, you know, she was non-responsive in the sense that she wasn't speaking anymore or anything like that. So when I went in and I started talking to her and I started singing, like she started trying to turn her head towards me to listen to me and was holding my hand, and the family was like, "Oh my gosh, she's reacting to this music." And I'm like, "Well, she wanted a party. We're gonna have a party for her," you know. And I did her favorite songs, and then she passed, and the chaplain Anthony went and prayed for the family, prayed over the body, and as they were taking her out, I sang again. And so, you know, that's what she wanted.
I think one of the things about Shelly is that, and I hear this so many times from after a visit with her, is, you know, they, you know, of course, you know, they're like, Shelly just called. Is that like the Shellylus? You know, and I was like, yeah. And I said, yeah, unbelief, you know, that she's taking the time to go and see them. And I was like, yes, yes, she, you know, get together whatever songs you think that she could sing to you and all that kind of stuff. But one of the things that they are really surprised about, and I hear this all the time, is how funny she is. And when she walks into the room, how the room just brightens up. And I don't know if that's kind of related because of the singing and everything, but it brightens up the room. It's like you could be like in a lonely state, or you could be in some kind of a depression, but Shelly's gonna walk in and she takes center stage, of course, you know, and that her presence just fills up the room and her voice fills up the room, and it just takes on a whole different experience. And, you know, people always call me later and tell me, I didn't think that visit was going to go the way that it did, and it was one of the best things in my life that has ever happened to me. And, you know, we try to get her to, you know, her schedule's tight too, and we try to get her to go back and again and again and again. But you know, they absolutely loved the visits with Shelly.
Yeah, I had another patient who he was bedbound, and he liked like more of the oldies. So Sylvia had let me know his favorite song, so I learned it and went in. And when I was singing, he was happy about it, but he started crying. And I asked him, I was like, are these happy tears or sad tears? He goes, no, happy tears. It's reminding me of when my wife and I, we would always dance. So she was in the other room. So I called her in. I said, oh no, you need to come in here. I'm like, and so I started playing. And so they started holding hands and they were kind of dancing. And she shared a story with me that he used to dance so much and he would do splits. And then he tore his pants one time. So we started talking about that and we started laughing. And, you know, y'all talked about it earlier, reminiscing, how you ask, how was this? You know, share this with me. And you'd be surprised how much people open up to you. And because this is things that we should appreciate about life, you know, our experiences, the times we've been together, the people that have come into our life, the people we've loved. And so it's a lot. It's very personal to us. It really is.
Yeah.
Because, you know, it's a human to human interaction.
Right.
And that's one of the things why we wanted to come on here, to let people know, you know, hospice is not a bad thing. It's a beautiful thing.
Yeah.
And we want to be able to share this time in their life with them, you know, and do what we can to make it the best for them.
But honestly, as it should be, because I've been in nursing long enough that I've seen many healthcare workers that just don't care.
You
And
get
it's
calloused, I
so
guess.
sad.
I guess you get callous.
It's so sad. And like,
Yes.
that was when I worked ICU, and I won't name where I worked, but
I worked ICU too.
yeah. One of the, I remember comforting a patient's family member that had literally just, minutes had just passed. And I had gotten to know them as a family.
Right.
And so I was there, you know, hugging them and, you know, tearing up and, you know, because it was very sudden.
Right.
And so I remember being told, like, you can't do that. We can't do that here. You have to turn that off.
It's so hard. I mean, it's hard.
And I was like, no, because I'm a human being.
Yeah.
That was a human, still is, right?
Right.
But
You have a lot
that
of
was their
empathy
love.
for people.
Right.
I have too much, girl.
I do too.
Like,
I think we all do. I think all of us at Harmony, we really do.
Yeah.
We really do. And that is a God-given gift too.
Yes,
For sure.
It is. I mean, for a fact, it is.
Yeah.
And God wants us to care for each other.
For sure.
You know, and that's what we do.
Yeah.
And so I totally get it. You know, when I was a caregiver, I had been paired up with my final patient for 3 years. And I had to stop seeing with her. I went through a surgery, so I had to take a break from her for a few weeks. And it broke my heart because I loved seeing her. Even though it was twice a week and I was on the road every weekend still, I look forward to that time I spent with her.
Yeah.
Because she became my confidant. She became my friend, really. And so when I was starting to start walking, I was, you know, getting used to walking again. I would go visit her and there would be another caregiver there. And I remember walking in for the first time and it was quiet. And I'm like, wow, this is weird because she loved music.
Yeah.
And I walked in and the caregiver's just sitting on the chair, like on her phone. And my patient was just sitting in her chair just like this, looking sad. And I'm like, why are you not playing music for her? She loves music. She loves being outside. Take her outside. She likes, you know, so I get it. It's hard to see people who, you know, don't really care as much. I don't know. I mean, it's sad to see that because I think you're in the wrong business. You're in the wrong business, you know.
I've definitely told some people.
Yeah, you're in the wrong
professionally,
business.
I'm like, just quit your job, walk
Just
out.
do something else.
Because you're not in the right place, and if your heart's not in it, then
And what if it's
get
that
out.
person's
you're
last day? Do
No,
you want them feeling that way?
Yeah.
You know, and so I'm just very grateful. And like I said, we have an amazing team
Yeah.
at Harmony, and everybody just gives their 150% all the way across the board.
Yeah, and it's a little things too. I mean, even, you know, like asking, you know, what kind of music do you like? You know, or what you know, what are some of your interests? So we can. It's a
That's
POC,
the first
right?
thing that
We
Lyris
built
does when
it.
she goes to visit the family.
Right.
That's the first thing that she does is she gets to know the patient and the family exactly.
And that's huge.
Because we have to know
It starts
their-
right from the beginning.
Their temperament
Starts right
too,
from
you
the
know,
beginning.
how are they, you know, that way we're prepared, you know, we understand. Because sometimes, you know, you go in and it's like, oh, it's not a good room, you know, so you got to figure out a way to make it better.
You know,
for
and
them.
a lot of times, I mean, I don't know if you've ever heard the saying that, like when babies are born, you know, oh, I'll never forget my nurse. You know, she did this for me. She did that for me. She made me feel this and that. Da, da, da. That's the same way that it's going to be in hospice.
Yeah.
The same way. They may not remember our names, per se, our individual names. They may not even remember the name of the company. But what's important is how you made them feel.
Yes,
That's
absolutely.
what's important to them. And that's what's important to all of us, because we feel like it's a God-given ministry.
Yes.
This is our calling to do this. And ironically, we're all family. So I guess, God just kind of sprinkled a little bit more on the Laurises.
Yeah, it did.
He
I think
sprinkled a little.
so.
See, we
I
all have
think
the same
so.
laugh.
Yeah, I think so, for sure.
Yeah, but but that's the thing, is that you're gonna remember no matter what. The family's gonna remember exactly the kind of experience that they had with whoever loved one is passing. And so it's just like it is in birth. It's the same thing that it is in death. And so those are the moments that are very precious to us.
And you were talking about social media too earlier. So we've been trying. Sylvia's been doing great. Lis has done it as well. Did a great job. And what I try to set, it's kind of tricky what I can share of my, because not all of my patients are filmed, right? Or taking pictures or anything like that. So I've shared when Lis and I go do presentations at group homes or nursing homes, we go do presentations. And those are the videos that fans are seeing on my social media of my interaction with them. And I think a lot of them think that that's all I do is the whole, a group setting. They don't understand that, no, I do the one-on-one. But it hits different when they see it. I did get to share one that my cousin Anthony and I did for one of our patients and his wife, and they were enjoying it, but we didn't show the face. But, people see that, wow, okay, they see it in a different light after that. Right. They're like, wow, well, that is nice. And, we do want to reach out. We do have questions, because there's a lot of people who don't really understand hospice. So, y'all don't be afraid to call and ask, they're experts at hospice. So any questions that you have, please call.
Can I add you to my list of things that I want for when
Absolutely.
I'm
I'm there, but I'm much older than you, so I don't know.
You never know, girl. You never. I mean, hopefully not. But again,
no, I would.
I like recordings that last forever.
Yeah, no. If I'm not there, you can play my song.
Yeah, right. Yeah, just play it loud.
For sure.
Yeah. Okay, so what's the most important thing that you want the people of San Antonio to know? Maybe about, like, obviously as a company, right? We've been talking about that, but the fact that you guys are family, and the fact that this is just innately in your heart, right? But anything else that people might resonate with that.
So when we were getting Harmony Hospice up and going and everything, it was important to us of what we named the company. And Harmony Hospice Care is just not a name to us. It actually is something that is embedded in each of us, that we have to have a good, harmonious relationship. All of us have to have a good, harmonious relationship with each other, as well as with our patients.
Of course.
And whoever we are talking to, referral bases, clinics, whoever is on the phone, it's that concept to us is super important. We want to have, when you talk to somebody having to do with hospice, you would figure that it would be somebody that is going to be easy to talk to. So that's important to us. Also, it was just ironic that Shelly, came on as our music coordinator, and we were also named Harmony. And somebody was kind of like, "Hey, does that kind of have a correlation?" It's like,
because
what?
we do have love for
Again,
music
God?
too. Our chaplain Anthony, my cousin Anthony.
Yeah.
I mean, he toured with me. He was my guitar player my whole career. So music is very important to us.
Yes.
It runs in our blood and our genes too. And just how we feel about treating other people, I mean, this is a God-given thing. Like you said, empathy, love, compassion, those are all things that you need to have to work in this. But people for just to call, because you know how it is when you need to call and make a doctor's appointment, or you need to call and order a medication. You're like, oh, it's something you dread, right?
Yes.
You dread it.
Yeah.
And we don't want that experience. So I think that's definitely something that I feel would resonate with the people watching and listening is, you're going to feel at home. You're going to feel that how we are. You'll feel our hearts to the phone. Yes. I guarantee you that.
I love
because we're very passionate about it. It's not just a business. This is something that I think it's like she said, we've said it several times. It's just a calling. It's just a calling, and we're doing God's work.
Yes.
We really are.
No, you really are. Like, again, like going back to my grandma when she passed, all I remember is a hospice nurse being like, "Oh yeah, the
See,
meds are in
and
the
that stays
fridge."
with you, and you don't want
Oh,
that.
it's been
Yeah.
like 10 years, and I vaguely
not a good
remember what
memory
she
for
looked
you,
like.
though.
Yeah, see,
No.
but the experience you remember.
That's not good.
But I remember I'm the only healthcare person
they look
in
to
the
you,
family.
uh-huh.
Yeah.
So everyone's like, "What do we do?"
Mm-hmm.
And I
Right.
was like, what do I do? Because that
Right.
was before I
Yes,
just
yes,
gotten my
uh-huh,
license,
yes.
my LVN.
Yes.
And so she's like, "Yeah, the morphine's in there and the Tylenol." And I was like, "Okay."
Like you would, yeah, I
and
know.
you know,
Yeah.
we want every patient. We make every patient important, and the family,
Yeah.
because it is a big thing, you know. And I understand it, you know. And being in the hospital with my father, his last days, you know, they really were good. So I'm very thankful for that.
Right. And
Because,
you always remember that.
yeah, I'll always remember
Just
that.
like you remember the good, definitely remember
Exactly.
the bad.
That's right.
Exactly.
Exactly.
Yes.
Yeah.
So again, we thank you so much, Natasha. You know,
of
you're my good
course.
friend, and
Yeah.
you know, she said yes right away when I asked if we can, you know,
Thank
be
you
guests
so
on your show.
much.
No question.
We
And
just
you're beautiful.
Yes.
Thank you, thank you. Appreciate
And
that.
she's a beautiful person too.
Yes, thank you.
And thank you, you know, again for having us, and just everyone watching and listening.
us share.
You know, be sure to give Harmony a call or look on the
Yes.
website. You want to
Yes.
give the info again? So?
Yes, I'll give the info. So Harmony Hospice Care of San Antonio. We are on Facebook at Harmony Hospice Care of San Antonio. You can also find us on our website at harmonyhospicecare.net. Our phone number is 210-807-7484.
And we do outside the community too.
We
you
do
wanna let 'em know?
surrounding. We do the surrounding counties as well. We service them. Mhm.
Okay, good
Yes,
to know.
uh-huh.
Yeah.
So San Antonio and the surrounding counties. Yes.
Good to know.
Yeah.
Yes.
I think it'd be good to go to a health fair on any other side of town that's not north side.
Yeah.
And
Yes.
truly only because I did my my doctoral project, and it was focused on east, south, and west.
Yes.
And what are the issues that people are facing on receiving healthcare?
Right.
And man,
Yeah.
a lot of, 99% of it was like access to healthcare.
Right.
So if, people don't know what they don't know.
Right.
And if they
Exactly.
don't know about y'all,
Right.
and you guys are like this,
Right.
Yes.
and,
Right.
but they don't know, and so you have the family struggling, and
Yes.
they're missing work, and they're stressed out, and they're, you know what I mean? And
No
then-
question is a dumb question either.
No,
That's
no,
And
no.
right.
you can
definitely
ask
not.
this question. Just that's what they're there for, to answer.
Well,
those
the
questions.
dumbest question is the question not asked. So.
That's right. There you
It's
go.
true.
That's right.
It's
That's
true.
right. Very true.
Yes.
Yes.
Yeah.
For sure.
Yes. Yeah, but we want to do all that. We want to do health fairs. Lis gets out there and she does all those events and everything. She's so good at it.
Yes.
You heard her, the way she talks.
Very
She's just-
knowledgeable.
yeah,
Yes.
she's very. She's a beautiful person. Not only here, you'll see it everywhere.
Yes.
Yeah.
Yeah, she's beautiful.
Also networking.
Yeah.
A few drinks and some hospice. You know what I mean? Let's talk about it.
We just recently started kicking this networking and marketing and all this stuff into a different gear. So
Yes.
that's really what our plan is, to really get the word out. And November is Hospice Awareness Month.
Okay.
So we're going to try to do more in November.
Yes.
Definitely.
Yeah.
Blast it all over social media.
Yes.
Yes. Well, thank you all for
Thank
being here.
you.
I
Thank
really
you
appreciate
from the
it.
bottom of our hearts.
Of
Yes.
Yes.
course, of course. If there's anything I can ever do to help, please let me know.
Thank you.
I mean, I'm happy to, give some time too if you guys need
Appreciate
help or
that.
Whatever,
Thank you.
whatever it is. But
You're awesome.
For sure, marketing.
Yes. She's good at it.
All right. I dabble. Yeah.
Thank you, guys.
Again. Yes, I appreciate it. Guys, thank you for watching. I really appreciate it. Make sure that you reach out, if not for yourself, for your family, or for friends. Just it's all about spreading the word. The good word. So thank you again to VodPod Media and to Latina Podcast Network. And I will see you guys next time. Bye.
Bye.
Bye.